So we're excited to kick off week 2. I'm going to turn it over to Mary Chamberlain, who's going to do today's presentation.
Thank you, Erin, and thanks everybody again for registering and being here today. So I will go through just some quick reviews of some studies that have been done on this topic of lifestyle factors associated with cancer. Some of them are a little bit dense, but they'll be available for you to go through slowly on your own as well. Next slide, please. So I would like to dedicate this session to Kim Dittis, who I think will be doing a session later in this course, but she and I have worked together on several projects, and she always has a great enthusiasm for workouts and vegetables. Next slide. This is a nice summary slide from the World Cancer Research Fund and the American Institute for Cancer Research, outlining various lifestyle things that have been connected in one way or another to cancer risk. And we'll go through those individually, but here's a nice summary just looking at weight, physical activity, diet, specific pieces of diet, what's good to consume, what's good to avoid, alcohol, supplements, breastfeeding, and then what to do after a cancer diagnosis. Next slide. So that came from a report from the World Cancer Research Fund called Diet, Nutrition, Physical Activity, and Cancer, A Global Perspective. And you can find the whole document at dietandcancerreport.org. Next slide. So is cancer is it inevitable? It serves that way sometimes, but actually many cases of cancer can be prevented. We're all at risk, but some are certainly at more risk than others. But I also see people in my practice who say, I've done everything right and I still have gotten cancer. So we haven't got it figured out yet, but we have identified some hints. And I think about it in terms of what things can we control and what things can we not control. So cancer is basically, the theory behind it is a multi-hit hypothesis, or a multiple injuries to the body, and some we can control and some can't. But in general, about 30 to 50% of all cancer cases are estimated to be preventable. Next slide. So the low-hanging fruit is obviously things like tobacco. Avoid tobacco products of any kind. That seems to be linked to the most numbers of cancers and cancer cases. And sun and artificial tanning are probably the other two things that seem to be most linked. Things to avoid that take more effort but are also effective is maintaining a healthy weight with a healthy diet and regular exercise, which you'll hear a lot about throughout this course. And to the best that you can, avoid long-term infections, radiation exposure, and industrial chemicals. Next slide. This slide I remember from my training. I really like how it outlines how things that happen in our society can ultimately impact the cancers that we see. And if you see this yellow curve on the top, that is male lung cancers starting back in 1930 and going up to 2011. So you see they peak around 1990, and that's because a lot of men started smoking around World War II, and it took about 50 years for that to show up. The women, this curve down here, started smoking in earnest in the 60s, and so they started getting cancers in a more wide way, but about 40 years later. So the other lines are different cancers, and they are relatively stable, but lung cancer, you can see, has really made a huge impact, and then nicotine and tobacco restrictions have also helped reduce those rates. Next slide. So some land studies in the world of breast cancer, which I'm most familiar with, come from the early 2000s, which means these were women participating probably in the 80s, 70s and 80s to contribute to the data that was finally published in the early 2000s. So the Women's Interventional Nutritional Study, or the WINS study, was by Dr. Chlebaki And he enrolled 2,400 women, all of whom had had breast cancer, and randomized them to a low-fat diet versus control or their regular diet. After 5.5 years, the low-fat diet group lost weight and had 24% fewer cases of breast cancer recurrence. But with longer follow-up, there was really no difference in overall survival. The biggest benefit seemed to affect those who had a history of estrogen-negative breast cancer, a subtype that is generally more aggressive. And that group had a 50% reduction in mortality due to a low-fat diet. Next slide. Another landmark study was by Pierce et al. In 2007 called the Women's Healthy Eating and Living Study. And this also randomized people to a low-fat but also high fruit and vegetable diet versus control. There was no difference in recurrence at 5.5 years, unlike the previous study, but there also was no weight loss. And the experts have thought that perhaps the difference in outcome may have been due to the weight loss component more than the diet. Next slide. The Nurses' Health Study is a large collection of data on women who all happen to be nurses, but it wasn't restricted to people with a history of breast cancer. But within that group, there were 4,000 who had early breast cancer. And when the investigators looked back on survey data about what kinds of things they were doing in their life, they noticed that the ones who were taking aspirin 2 to 5 times per week seemed to have better outcomes, lived longer, had fewer recurrences, and survival. And the reasons why they were taking aspirin varied. 35% took it for heart disease prevention and 65% for joint pain, headaches, muscle cramps, etc. Next slide. Other studies have looked at anti-inflammatories or non-steroidal anti-inflammatories, and one study out of Iowa noticed that regular use of ibuprofen seemed to reduce the risk of recurrence. But when that was done in the prospective level, meaning people without cancer were tracked and followed to see how many took aspirin, it didn't seem to reduce their first episode of breast cancer. Next slide. So what this suggests is that the inflammation component or the anti-inflammation component of aspirin has more impact on those who had a history of cancer than those who have never had cancer. And it's not clear exactly why that is, but the higher doses seem to have more of an impact, which means it prevents inflammation. We currently have a large prospective trial going on here at Dartmouth and all over the world that is randomizing people to 300 milligrams a day versus placebo for 5 years to see if that simple intervention may add to better outcomes. Next slide. So what about diet? There's a lot out there about that. It's really hard to control, obviously, exactly what people eat. There's so many variables. But an integrated approach to considering the evidence shows that most diets are protective against cancer are rich in foods that are coming from plants, so vegetarian-based diets. Diets rich in whole grains, vegetables, fruits, and beans should be a regular part of people's daily diets. Next slide. So specifically, that means 30 grams per day of fiber from food sources that contain whole grains, non-starchy vegetables, fruit and pulses or legumes such as beans and lentils, at least 5 portions or servings of a variety of non-starchy vegetables and fruit every day. And if you're in a part of the world where starchy roots and tubers are staples, then it's advised to add to that with fruit and legumes on a regular basis. Next slide. If you eat red meat, it's important to limit consumption to no more than about 3 portions per week, and that means about 12 to 8 ounces of red meat, and very little, if any, processed meat, and I'll explain the associations with those things later on. Next slide. So in summary, from this continuous update project, there is strong evidence that physical activity protects against cancers of the colon and endometrium, but that also those are associated with preventing weight gain and obesity. So it's not clear which comes first. Is it the physical activity or is it the obesity is directly related to these cancers? So physical activity may also indirectly contribute to reducing the risk of cancers that are thought to be related to obesity, like esophagus, stomach, pancreatic, gallbladder, colorectal, breast, ovarian, endometrial, prostate, and kidney. So a lot of cancers are connected to obesity. Next slide. The general exercise prescription, and we talked about this a bit last week, is 150 minutes of intentional exercise or 75 minutes of vigorous exercise a week, strength training 2 to 3 sessions weekly, and flexibility recommendation, regular stretching. Next slide. And if you are at a sedentary job, even if you do your 150 minutes a week of exercise, it's important to make up your day. And because some studies are showing that all of that exercise is sort of wiped out if you sit at a desk for 8 hours at a time. So it's important to intersperse sedentary activity with bouts of standing and physical activity. Next slide. Some of the work that Dr. Dittis has done compiled data on physical activity among cancer survivors and those who have never had cancer, and found that 87% are not meeting those recommendations of regular exercise, and even more cancer survivors are not meeting those recommendations. And so that's why, as a cancer doctor, we're really trying to find ways to make it easier for people to meet those recommendations, and that was one of the motivations behind this course. Next slide. Walking is the most commonly identified physical activity and the most accessible. 38% of adults report walking for exercise, but only 37% report meeting the actual recommendation of 150 minutes a week. Next slide. Intensity is important, as we mentioned, and you can kind of translate that in your own workout by how many steps per minute that you're doing. 100 steps per minute is considered moderate, whereas vigorous means running roughly a mile over 10 minutes or 230 steps per minute. Next slide. There's also data to suggest that interval training may improve outcomes a little better than regular moderate exercise. And that means bouts of sprints followed by 2 minutes of recovery compared to moderate intensity, compared to controls, which is presumably much more sedentary. And there was an increase in fitness with interval training. The mechanism behind physical activity in general, in terms of cancer prevention, has to do with insulin levels. And they saw in this study that the interval training and the moderate intensity both improved insulin sensitivity, as well as some more specific studies on the actual mitochondria, which are cells inside the skeletal muscle, seemed to be affected in different ways. Next slide. So some statistics about exercise is that it appears to specifically decrease risk of colorectal cancer, probably also postmenopausal breast and uterine cancers, and it obviously clearly decreases risk of obesity. Whereas screen time or sedentary activities increases obesity in children and increases the obesity in adults. Next slide. So this is one of my favorite studies looking at what exactly is exercise doing, and this is a little bit potentially off-putting for some, and I apologize, but it's basically studying stool samples in people who exercise and those who don't, and trying to learn about the microbiome of the gut and how exercise is impacting that. This was published last year, and investigators explored the impact of 6 weeks of endurance exercise on the metabolic output of the gut, in other words, stool samples, in lean versus obese adults with multiple dietary controls. Next slide. So 2 people, so there were 18 lean females, 14 obese females, all of whom were previously sedentary, did a 6-week supervised endocrine-based exercise training, that progressed from 30 to 60 minutes and from moderate to vigorous. Then they returned to their sedentary lifestyle, and stool samples were collected before and after exercise, as well as after a sedentary washout period. This showed that the fat in the stool was actually broken down better by those who exercised compared, and specifically in lean people, compared to those who were obese. So the weight of the person starting out at exercise was very important, and clearly exercise helped metabolize fat, and that is thought to help prevent obesity, and that is linked therefore to reduced cancer rates indirectly. So we're still trying to figure out exactly what exercise does. This was one study that was trying to get at that, suggesting that it impacts our metabolism significantly. Next. So now just quickly running through all of the different lifestyle things and how they're associated with specific types of cancers, and then we'll open it up to the cases. So whole grains and fiber specifically impacts the risk of colon cancer and decreases weight gain or next slide. Beta carotenes, or orange fruits and vegetables like carrots and squash, decreases the risk of all aerodigestive cancers, meaning mouth, throat, esophagus, lungs, stomach, and colon. But too much is not good either. There were a couple of studies that looked at those carotene supplements and found that those did not improve outcomes in people with lung cancer. Next slide. Red meat and processed meat are associated with colorectal cancer, and especially processed meats increases that risk. Next slide. Dairy products appear to decrease the risk of colorectal cancer, and we saw before that low-fat dairy products may decrease the risk of estrogen-negative types of breast cancer. Next slide. Foods and fish that are processed or preserved by salt, which is more common in Eastern or Far Eastern countries like Asia, increases the risk of nasopharyngeal cancer and stomach cancer. Next slide. And arsenic, if it's present in drinking water, appears to be associated to an increased risk of lung cancer and probably also bladder and skin cancers. Next slide. Breastfeeding decreases the risk of both premenopausal and postmenopausal breast cancer. And if you were breastfed by your mother, you're less likely to become obese as an adult. Next slide. Coffee probably decreases the risk of liver and uterine cancers and really doesn't have any known increased risk of cancer, which as a coffee drinker makes me very happy. Next slide. Alcohol, on the other hand, increases almost every cancer. So mouth, throat, esophagus, liver, and colorectal, probably also stomach and premenopausal breast cancers. And it increases the risk of recurrence if you have a history of breast cancer. It does seem to decrease the risk of kidney cancer, however. Next slide. And Mediterranean diet, we've heard a lot about. That means lots of fish, olive oil, fruits and vegetables, not a lot of red meat. Decreases the risk of obesity. Other studies have shown that it clearly decreases the risk of breast cancer. Other studies have been a little less definitive about that. And Westerns or high-fat or fast food diets definitely increase the risk of obesity. Next slide. So in summary, cancer is preventable to some degree. Important not to smoke, try to minimize alcohol, drink lots of coffee, don't spend a lot of money on supplements, and avoid gaining weight. Eat well and often. You'll learn a lot more about this on June 4th with dietitian Janine Mills. Stand up and work and minimize your screen time. And everybody keep up your excellent work, keep exercising. And come back to these sessions. You'll hear a lot more about these topics, specifically on cardiorespiratory fitness, exercise prescription, and how to help with behavioral change. Thanks for your attention.